the churches and the hospital come together. The collaboration is great because we are people here to help people.
We can build that bridge to the community to begin to get the messages out about early detection so that people may have a better quality of life.
It's an awesome program. SCIT means Stop Cancer in Its Tracks. It's about getting the information out to people. It's about prevention. So there's a lot of correlating this health with the health of the body of Christ and the community. So I think it's a great put together.
Today, there are so many opportunities when there's early detection that it just makes good sense to be ahead of everything in your health, especially as it relates to the potential of having something as serious as colorectal cancer. I don't think that I can stand in front of my congregation and share with them that they should be healthy, that they should have a primary care physician, that they should do all of these things, and I'm not doing it myself.
Taking the medicine before the colonoscopy. Now that's probably the worst part of it. After that, it's probably a good 20 minutes and you're back into what you were doing in life. For me, it's really important. I've got a sister and a mother who are cancer survivors. They had no idea that cancer was growing in their body. And so that's why it's good to just have screenings and regular checkups. Men are less likely to go because, you know, we believe we're men of steel, we're Superman. But the truth is a lot of the men are skeptical of going into the doctors, or usually we find most people don't find out anything until they go to the hospital, and by then it's almost too late. First of all, you should love yourself. And part of loving yourself is taking care of yourself. And man, this is probably one of the most simplest procedures. The worst thing you can do is leave your family and you could have still been here.
More and more of the hospitals, and especially, you know, our favorite Cleveland Clinic, are opening up to carry health messages to the community. And every time one of us says, hey, I did this, it was a positive experience, then that gives encouragement to somebody else. As calm as I am, there's still this anticipation. Is there something? Wow, if there is, and what does that mean? Being the kind of person I am, I settled those things in my spirit, but that question is in my mind.
It's not a surgery, just a procedure where they go in and take a scope, look inside you, you know, and see if there's anything there, but they take the polyps out because they can become cancerous if they stay in there.
Good news that there are no polyps, all right? So you're good to go for 8 more years.
Even if there had been a challenge, to know that I have a great doctor, I have a great medical team, I'm in a great place.
It's not as bad as you would think, but I think it's a very big deal because it's your life. In and out, it doesn't take long, and it's a very comfortable procedure, believe it or not, gentlemen.
Take the screening colonoscopy seriously, because we have seen patients who come here with late cancer where they cannot get rid of it completely by surgery, and they regret that they did not get their screening colonoscopy done. So everybody at the age of 50, listen to your primary care physician and ask for your screening colonoscopy.
The awesome thing about Cleveland Clinic is they have a system of navigators. These are people you can call and they almost become your friend, and they'll begin to navigate you to a doctor, to the area you need to get the information, help, or services. So you don't have to come in to be a stranger in Cleveland Clinic.
As spiritual as we are, if we're not taking care of our temple, we are not doing justice to all of the wonderful benefits and privileges that God has given us. My personal goal is to make SCIT and make healthcare and health ministry as important as any other ministry in a congregation. But our overall goal is exactly what it says, stopping cancer in its tracks.